We had indicators that said that we had a very high stunting rate in Bomet. It was standing at 36%, or that's 5.5%, as compared to the national average of 26%. Through that, we sought interventions, and one of them was to talk to like-minded partners. The national government and Nutrition International, which is a Canadian firm, came in very handy in this and supported us in identifying which interventions we would actually do so that we try and bring down.
From our situation analysis around 2016-2017, we discovered that Bomet County was one of the counties with high stunting rate in the country. This was an eye-opener to the county and also to partners who are working here. And Nutrition International came in to provide both technical and financial support so that the county can scale up high-impact, low-cost nutrition interventions to address this issue.
The model we have chosen to use is what we call the low-cost but high-impact interventions, whereby little intervention, little resources is able to achieve a lot in changing the life and the welfare of the people.
We ended up with identifying 10 key result areas. Some of these are those ones that are specific to health, and some are those ones that are sensitive.
With agri-nutrition, we've been working together to make sure that we trained our farmers and our community groups to have multi-story gardening. This is one way of ensuring that with limited space, households can have diversified vegetables and ensure nutrition security within the households.
Kimine spinach, kimine soy, kimine sukuma, kimine ingwek alak tugul. Makindoi kityo cabbage, makindoi beetroot, amun ingwek choton koechen.
Garden ko ager manake ako sana koibe minutik chechang ngalekab nutrition tugul kokeshinkei reyu ako kager kora ale sana en biikab town chebo landisiek kotoreti kitchen garden neuni.
We are embracing the kitchen garden technology, which is agricultural smart. One thing which we need to embrace in our county is the consumption. That every member of household, they need to take sufficient vegetables at every time during their meal time.
After the training, I came back home and I have been working with groups. Right here with me are members of Lower Chebangang self-help group. We have encouraged them to plant various types of indigenous vegetables. We also do bananas and has avocados, and we encourage them to also rear chicken and goats.
Ko kikikilgei en grupit nitet kingemwoe kele kemin ingwek Nutrition is not merely a health issue, but it's a development issue that is affecting us economically and derailing the county financially.
Chronic malnutrition is devastating for children. It affects their cognitive capability, it affects their immune function, and generally, it is debilitating.
This joint partnership has really strengthened our working relationship between the two of us, the county and Nutrition International.
More effort and more investments are going towards preventive health rather than curative health.
Got training from Nutrition International, and we were trained on how to install such a garden. So we have installed this kitchen garden, and for the purpose of training of CIFs.
One of the successes that we've had in this program is that we have children who have made poems targeting healthy diets and physical activities within the schools. And this will improve in cascading the nutrition information within our communities.
Maziwa yana madini, undamela na mifupa, nyama mayai maini, na madini yatakupa. Sitajijenga amini, kinga ya magonjwa hapa. Nyongera nitakupa, ukinilinda tumboni. Kula njugu na maboga, protini nguvu tapata. Kula matunda na mboga, kinga ya magonjwa hapa. Aina nyingi za mboga, rutubisho zapata. Itilafu sitapata, viungo vyote kunoga.
Nutrition International is very keen on integrating gender in our nutrition programming, because you cannot ignore the fact that nutrition itself is a gender issue. When you look at households, even in Bomet County, that have gender issues, households that are experiencing STBV, high poverty levels, teenage pregnancies, it is these same households that also have high prevalence of malnutrition and even high prevalence of different disease and infections. To address this, Nutrition International is supporting a training of health workers on gender equality in nutrition. And on top of it also, we have developed and distributed gender fact sheets that address key issues on gender that affect nutrition, and posters that will also get to the community level advocating for gender equality for better nutrition programming.
Bomet County, in partnership with NI, has assisted us in supplying commodities like vitamin A supplements and IVAS. The constant supply of IVAS supplements has assisted pregnant mothers in preventing iron deficiency anemia.
We are participated in minimum training and BFCI's training. And after attending training, we have trained our colleague through CMEs and share the knowledge we gained during training.
After we were united, we connected noton for a sub, paginetwa mama. Kiginetwa mama, ele muche ko paita log, ko chuchu log, ke aroiglo fululiso chema telele.
We have male involvement in this programming so that we engage the male partners to support these interventions, because they are the key people, key decision makers within the households.
Igonyor support koyob NI kekonech kimi rabinik chekakone ketoreten grupit nekanyone kikialen arekab ngokenik nguni kokoechitu ngokenik choton. Kesich mainik ra kosiche lakwet kwamut maiyat konyor health.
Tam kengete kityo en olikinye ko kikichundoi kityo en akina mama ngonyikis kwendi ineken moingen kole nee netesetai. Ko nguni kokokikoi support kikere kokowalak community. Kikinyon kinetech kora akobo amitwogik cheome bichu yon nyikisen. Konetech akobo 10 food groups Mi ingwek kou sukuma, miten isoik, mi sagek. Ko kikakinetech koteche koin kimnotet.
Bomet has manifested all the 5 forms of malnutrition, which includes stunting, wasting, underweight, micronutrient diseases, and overweight, as well as obesity. For us, we really focused on the different levels of programming so that we have interventions targeting our health facilities, our communities, and even within the commercial setups. We look at interventions running all the way till the child is born, what you call the 1,000 days of life interventions. After delivery, we ensure that we follow up. That is what we call the baby-friendly community initiatives.
Kinetan ele chuchundo ak kinetan kora kele anindo lakwet kingangaruk kiotorchini moet. Ak kokuk. Ko kakinetan kelenjon yekatar arawek 6 inam ibai. Ak kotesetai kora kochuchundos. Abai iman ak amitwogik cheterter. Koboto mainik ak marakwek ak ingwek cheterter. The misconceptions around behavior affecting our attitudes and how we take food has really improved, so that men have time to really learn from the other influencers that have done the appropriate practices, such as supporting their spouses during childbirth, for breastfeeding, and even taking care of the child until 5 years.
Alen kora boisho amwoe ale kitoreti kora keribe tugul lagochu.
Alenjini amwoini kamatik chetindoi lagok chemengechen alenjini korib lagok, kochuchusan lagok arawek 6, matkosib kobai lagok.
We have invested in our health facilities by ensuring that they are baby-friendly hospital spaces, so that when a mother is coming for care within their 1,000 days lifespan, they get the interventions that scale up nutrition interventions.
After the training we had at Sotik in partnership with the county government of Bomet and the Nutritional International, we came up with a breastfeeding station whereby we used the locally available materials.
Before, our mothers used to come for immunization. After just the injection, they just go and breastfeed their children at home. But nowadays, they have to relax, they breastfeed, and it has really empowered them on exclusive breastfeeding.
As a midwife, I'm interested in delivering a healthy baby and also a healthy mother. We ensure the mother takes IFAS during her pregnancy. And then, of course, we advise her to come to the clinic every month.
We are promoting the availability of breastfeeding spaces for working women.
We support our staff who are breastfeeding. As we know, the importance of breastfeeding. It assists in children in growth monitoring and also prevent illness among our children.
Recently, we have established a breastfeeding space in Mogogosiek, and we are looking up to establishing one in each of the markets within Bomet County.
We have opened a room for for breastfeeding mothers in Mogogoshet. That is to enable our mothers to have good time with their kids when they are young, to get enough and sufficient breast milk, and to enable our mothers also to attend to their work as well as breastfeeding their kids.
Ui kasit imuche isekeni ingwek mi lakwet ero mi kasisiek alak chekonye so kotam kebwone yuton inyonyesha lakwet ak iwolchini kora tuguk cheloche ak kora kokeitwo iun eut ak iweke kasingung ko kikotoretech ireyuto amun kingonyoketech komau yukitai kikowalak sobet kiterit
kikotoretech kabisa konyonkoyotin kot en yu nekiriben lagok so kikoribwech kabisa kamatik chetinye lagok kikokonech kotililekitu wamama.
Kitinye ile kiwolchinen lakwet pampers ak kiun eut en yoton ak kimoko lakwet koru.
The county government of Bomet has been able to increase the financing on issues nutrition from 500,000 then, now standing at around 17 million. That is just for the county government. And then that means the same is reflecting from the Nutrition International. What we have done is that the Nutrition International deposits their money in the special purpose account. And then now we use the government structures. We use the county government structures to source the money and to account for them. So we have been able to increase so that if you move to any dispensary or health center or any health facility within Bomet, you will find that we have weighing scales to monitor the growth of the child from onset to the end.
We received donation of 2 weighing scales, one for the MCH for children underage and the other one for the adults. We received support from the institution as well for supplements, vitamin A and IFAS.
I must really commend the progress that we have, the strides that we have made as a county government and as the Department of Health in general over the last couple of years with the partnership that we have with the Nutrition International.
It is a very wide field and we really want to thank the Nutrition International and the county government of Bomet led by Professor Hilary Parchok for giving all it can to make sure that we improve on the nutrition condition across the county government of Bomet.
As the county assembly, we are doing well in supporting the program, especially in budgeting of the program. We understand that malnutrition is a problem to our county. So we have now started being serious, and I want to thank our partners, the donors like NI, for being with us and making the county to move very fast in making this program succeed.
We started with supporting the Bomet County to come up with a CNAP, and a CNAP is a county nutrition action plan that looks at all the key activities within the county that pertains to nutrition, which are multi-sectoral. So looking at different sectors like agriculture, education, where they are looking at some of the nutrition sensitive activities they can be able to support. We had an agreement with the Bomet County, which is a 3 years agreement, which will be coming to an end in 2024. We are in the current process of developing a nutrition policy, and the reason of this nutrition policy is for us to be able to mobilize resources from other sectors to ensure that we have more resources to support nutrition within the county.
Bomet is one of the counties that have lived up to their financial commitment to support the program, because the program runs on a matched funding arrangement where NI gives the same amount that the county puts into the program to support health and nutrition programs focusing on women, adolescents and children under 5 years of age.
I'm happy with the support of the Nutritional International. We have been able to have a very clear roadmap on how we can institutionalize some of these interventions that are local. We found it necessary for us, with the support of our partners, to come up with a very clear program of how we can have small interventions that are not very expensive to correct this kind of situation. We've been able to come up with a very clear roadmap that will be funding jointly with Nutritional International, and I'm happy to report that ever since the time when these interventions were put in place, we have registered positive progress. The standing growth in our county stands at 22%, an improvement from 36%, which is a very clear message to us that we are making progress. Initially, I think we used to have close to maybe approximately 500,000 for nutrition-related programs. But when we joined hands with Nutrition International, we have been able to mobilize our resources internally, and currently we are doing around 17 billion from our own resources, because our funding model is shilling for a shilling. Nutrition is not an health issue, it is our issue, cutting across all the sectors and departments. So we are streaming, and we are looking forward, even going forward, that each and every department will be having an aspect of nutrition in terms of budgeting.
Titi la mama tamu, kuilinda